Welcome to the Honest Psychologist podcast, where two licensed clinical psychologists have joined the chat. I'm Dr. Whitney Graff.
I'm Dr. Paige Hover. We bring our years of expertise to the conversations you're already having, breaking down the topics shaping culture, social media, and everyday life.
No psychobabble, just relatable discussions about how our minds work and why it matters.
Well, hello, everybody.
Hey there.
Welcome to today's episode. So today we are going to be talking about the question of if your therapist should always agree with you, or kind of the idea of should they challenge you.
So in preparation for this episode, I did what I've been doing lately, and I just put it into ChatGPT.
Oh, nice.
I was kind of curious what it would tell me as far as like what the prevailing thought process is on this. I can't quite remember exactly what we were thinking when we put this on our topic list, but I feel like if I'm being, generous, like most people would say, no, your therapist should not always agree with you. And like, okay, see you next week. Like that's our episode. But there's got to be more to this because, and so I was asking Chat, I said, what do most Americans think is the role of a therapist?
Ooh, good question.
And it says most Americans, we can see how much we think this is true. Most Americans tend to see the role of a therapist through a mix of traditional and evolving perspectives. Commonly held beliefs include emotional support and guidance, listen, offer support, navigate emotional distress, transitions, and struggles as problem-solving experts. It says some see therapists as experts who can help fix, quote unquote, their problems and give advice similar to how a doctor would treat physical illness. This is especially common among people newer to therapy. I don't know where it's getting any of this from, by the way, but maybe. 3, as mental health diagnosticians to identify and treat mental disorders, anxiety, depression, using evidence-based methods. As non-judgmental listeners, therapists are seen as safe, confidential, unbiased people when someone doesn't want to burden their family or friends. As life coaches or self-improvement guides, especially with the influence of social media and wellness culture, some people now see therapy as a way to level up emotionally or increase self-awareness and not to treat dysfunction, which is interesting. And then the last one is relationship mediators, like in couples and family. And then I asked it, what does polling show about Americans' attitudes towards therapy?
Ooh, good questions.
I love Chat. So a majority of Americans, 53%, view therapy as effective or very effective. There's broad support for therapy. Women, 72%, and men, 55%, believe that everyone can benefit from therapy. And among those who've undergone therapy, 70% report a positive impact. 34% describe it as very positive. And then the last thing I asked it was, do a lot of Americans believe their therapist should agree with them? And it didn't give me any like cited like Wikipedia, I think. So it doesn't really have a lot of, data to support any of this. A significant number of Americans believe their therapist should agree. Oh, there isn't data to say that the therapist should agree with them. But research highlights the therapeutic alliance. We could talk about that a little bit. Collaboration on goals, development of a personal bond, clients value feeling heard, validated, and understood, which can sometimes be misconstrued as expecting agreement. However, effective therapy involves offering perspectives that may challenge viewpoints and promote growth and insight. What do you think?
Yeah, I mean, I think I would agree with a lot of those points. Like, I think it can get sometimes misconstrued, like kind of to that last point of support, validation. And I think about that a lot in what I see in therapist profiles, what I see in therapist websites, like when they're describing themselves, like validation is a really important piece in forming a therapeutic alliance. And I think that that is obviously like you want some comfort there. But I think that sometimes it can be, and not everybody, I don't think that everybody feels that way, but I think that sometimes it can be construed as you're going to agree with me, and I think also certain situations are different, like I think about couples therapy a lot, like the person may, there's always one party that wants the therapist to agree with them. And usually both parties, I would say, right? Like both their parties go into it hoping the therapists agree with them.
Yes, but one person's often initiating it. And I mean, I think it's very understandable. They are secretly saying, I'm going to take you to therapy, and the therapist is going to tell you why I'm right.
Yes,
I get it.
exactly.
I would do the same thing.
Same,
Totally
same
get it.
there. So yeah, I mean, I think that there's this I think that therapists really put out this emphasis on validation, but I think that there also has to be um I don't know, like I find it hard like when I'm writing my own profiles or when I'm doing that because I do want people to think and I do want people to maybe not always feel super comfortable, because I want them to grow and growth is uncomfortable. It doesn't
Yeah,
always feel like
Paige,
the best selling point.
you don't want people to feel comfortable? My God, you're a monster.
But as far as marketing is concerned, it doesn't really.
Oh, I mean, this is such an interesting point. Like, how do you sell this product slash service?
I don't I don't know. I've many a times I've typed it out and I've read it back to myself. I'm like, huh. Or like it's gonna get worse before it gets better. That's 100% true. But I don't know if that's my marketing piece where I'm like, hey, come to therapy with me. It's gonna get worse before it gets better.
Well, exactly. It's like what you said, that growth is uncomfortable. Um, I think you and I have said this before that like it seems like the most effective way to sell what we do is to it's like akin to personal training, where
Yeah.
when you go to the gym, you expect it to be in some ways kind of painful and uncomfortable, but you also want to leave feeling like it was a positive thing that you did and that you
Mhm.
got something out of it. You didn't waste your time. It wasn't like it wasn't an environment that filled you with sort of dread, when the gym becomes this place where you're like, oh, I just feel terrible about myself there. And, if there's some sort of vibe to this type of gym and you're like, I just hate being in there. So it doesn't matter how much I gained in terms of my fitness. I just hate walking in the door.
Right.
I think that's maybe what they're talking about when they're talking about the therapeutic alliance, which is obviously something we know a lot about. But
Right.
yeah, it's like that general vibe. Like, is this a place where you are, you're okay, you
Mhm.
know?
Like I think that there's the foundation, right, of I've got your best interest in mind. I hope you can trust, like building that trust that I can say something that might be hard to hear and you'd be willing to hear that. Like I think there's some foundation that really has to happen with that. And I think a lot of that does come from some validation. Um and it's funny, I was thinking, I was like, well, when do I start like delivering the like, hey, here's some growth points? I mean, I think I probably do it pretty early on. I'm just like, well, like here's some other thoughts to think about if there's something I disagree with, or it's like, oh, hey, I can understand that being a pain point, or, kind of stuff like that. But I think that the therapeutic alliance is meant to kind of develop like a foundation of trust that hey, like this is I'm not just doing this to be mean, or I'm not just if we go back to the
Right.
gym example, I'm not just doing this to make you hurt. Like there is a kind of idea behind it. There is this like foundation that I'm doing this for your own good a little bit. But sometimes that can be kind of hard.
Well, no, I mean, and what you said as far as the timing, I mean, there's a psychologist who um, he's written some of the therapeutic manuals, that we've read. His name is Gareth Holman, and I use something that he wrote to me when I teach my class on the Therapeutic Alliance because I was asking him about. We were talking about timing and when do you start addressing things that seem to be popping up as, aha, I think this could be getting in your way, or it's showing up in the room. And his response to me was like, pretty much right away. I don't want to set a precedent where kind of anything goes and then later have to say, well, I think we need to work on this. He's like, no, I think we need to start working on it pretty much right away, but that doesn't mean that I want it to feel punishing or, judgmental or something like that. But things can show up like from session one,
Oh, I
you know,
agree.
absolutely. Can I cop to something here?
Yeah.
I totally want my therapist to agree with me. But okay, like I can feel it. I can feel that I'm like, agree with me. Tell me I'm right. Tell me that you see like my brilliance. I've given these things a lot of thoughts, and I would
Yes.
like you to see how how well thought out my points are. Um, and at the same time, I think one thing I have like been right on the verge of asking for from a therapist is like, what are you holding back? What are you not? What do you think my problem is that you're too afraid to tell me is my because I'm like, what if I decide right now I'm tough, I can handle it? How am I in my own way? I can't remember if
Mhm.
we're swearing on this podcast. Like, how am I screwing myself over and
Yeah.
I'm not seeing it because I clearly am in some kind of way. And if you get too much agreement, if you get too much validation, too much like, I see where you're coming from. Yes, totally. It completely makes sense the way you feel. I feel good in the moment and I feel stuck longer term.
100%. Yeah. And I think a lot of it has to do with what you're ready to hear. Like, I think that if sometimes it takes a minute in therapy a little bit to feel ready to hear some of those hard truths, and to look at yourself. I think I referenced this the last podcast, but I was at Trader Joe's checking out, and this guy found out I was a psychologist, and he's like, "Oh, what's the most interesting thing you've learned about being a psychologist?" And I, feel kind of on the spot, but what came to mind was how hard it is for people to know about themselves and how little they actually want to know. And not in like overall, but the doses of which you need to like to be able to handle hearing what people maybe really think or some honest truth. Like you can't have a big old healthy like bowl of it. You need like a spoonful at first, And I think that is I think that we've seen kind of what Chat GPT was saying of how people think about therapy. It's not always people thinking it's something that it needs to be fixed or something is broken. It's this level up. And I don't know if you're going to be serving hard truths when somebody's looking to kind of just like level up versus like, hey, I need to really understand myself. And I think different people are at different stages of that. So those are my 2 cents on it in general.
Yeah. Yeah, I mean, that comes up when we do assessments. um, I play devil's advocate with people before I even let them sign up for assessment, especially if we're looking at patterns of behavior with yourself and with other people
Hmm.
that are probably part of the thing that's keeping you stuck, like whatever that is. If it's like, I've been through all this eating disorder treatment and I can't seem to get better from it, or I can't, I seem to have been depressed for so long. I'm like, well, most likely stuff is going on in this kind of complex interaction between how you think about yourself, how you think about other people, how you interact with the world, what sort of responses you get back from them. And that kind of web of interactions we call personality. But I wish we had a different term for it in many ways,
Mm-hmm.
because I think it can be useful to learn those things about yourself. And I think those are the moments, even if they're painful, where people go, "Oh my God, I am doing that," you
Mm-hmm.
know? Or I know I do that and I can't seem to figure out how to stop, but at least we have acknowledgement of the problem. But if you call it personality, it literally implies it's the person.
Yeah.
And when people are coming in, they're like, I just don't want you to tell me that it's me or
Mm-hmm.
that I'm the problem. Oh, yeah, I don't want to tell you that either. Like that's
Yeah.
never, and I think that just touches right up against shame and judgment. And then it becomes completely useless when we're feeling ashamed. The function of shame is to hide and get away from other humans so you don't infect other people with your badness. That's what shame does. It says like you're bad to the core and you must get away. And so as
Mm-hmm.
soon as you touch against shame, you no one can listen, you can't
Nope.
learn, you can't regulate, it won't work. And
Nope.
but there might be important things to learn. And so trying to keep it away from like that central, this is how I think about it, like that central you-ness, like deep down
Yeah.
inside, where you are worthy and you have human dignity and you matter
Yeah.
to the world, that like central inarguable worth of the person. And then like layers and layers on top of that, like many layers above that, it's like yes, and the way you're managing moods right now is causing problems in relationship, but that doesn't touch that central part.
Yeah.
Or yes, and the way that you're um you know whatever, name some sort of psychological process, it's not
Mm-hmm.
working.
Right. And also, I think at that level, you will start to understand that maybe that doesn't show up with everybody. Sometimes that shows up with another certain type of personality type. Like you'll get to know the nuances of that. But I think that it's a lot to take in because shame can so easily just be like laying in waiting. And I think that that's sometimes where I think it is a little easier to start therapy thinking about a problem that you want to fix, right? Because it's so external versus like, I'm going to go and learn about myself. Like I want to get deeper. I want to understand myself. That is, I think it's vulnerable, like, and I think that sometimes it's easier to focus on, okay, I'm going to get in the door because this, like, I need to fix this problem. And I see that happening a lot in my work with clients as we get to that point where it's like, okay, well, we've kind of addressed the problem, but they want to stay, right? And they're curious, and they want to know about themselves. And it's like, okay, well, this is a shift now. We're not going from problem to solve per se. We're just going to kind of get into the nitty gritty of there. And I think that's where I wouldn't say the honesty is even more potent because it's always potent, but I think that's where it's like, okay, like, hey, are you ready to see some hard truths? Or are you ready to see something that's like, are you ready to unpack something that's maybe more vulnerable that you want somebody to agree with you, but you don't at the same time? So it's like, oh, because I could
Well, here's my
grow if you don't agree with me.
here's my thing. I feel like if there's an issue, something is not right, you are stuck, it gives you something to anchor to. Like when you can say it's not working, so I might be willing to tolerate these uncomfortable truths about myself because it gives me something that I can do, some ideas or whatever, to make my life a little bit better. And I might reap the rewards of that. I think I, as a therapist, struggle a little bit when we have entered that realm of, well, I just want to learn about myself, or I'm just looking, for improvement. For me, the hardest one is like, I'm just looking to optimize because I don't think that's possible. We're all messy humans, and it doesn't matter how hard you work, you will never outrun being a messy, imperfect human. So I cannot optimize another human being. And so if I don't have something that we're sinking our teeth into, like a problem, then just learning about myself can feel a little bit it's intangible. Like we
Yeah.
can't grab onto it. And if I do tell you something that I've noticed that seems to be, you know, might be hard for you to hear, might be difficult feedback. It's like towards what end? Just
Mm-hmm.
just a slight bit of self-improvement. I'm not sure that's really going to be worth it to a lot of people. In some ways, if we're all messy and imperfect, I think we all have license to just go on about being messy, imperfect people who don't have to fix everything. And so it's just sort of my style. I'm more likely once we don't have an actual point of stuckness that we're working on, I will suggest termination from therapy.
Mm-hmm. Yeah. And this is kind of getting into a little bit of a different topic, but we can talk about that because I see that as I get to that point a lot with clients, and they will both kind of be like, okay, what are we doing? What are we doing?
Oh, yeah, the what are
And
we talking about? Okay.
and we'll check in. And oftentimes I have clients that are sitting there and saying, it's like, well, I like this. Like I like thinking about this. I like coming to therapy. I like, I'd like to, I don't get them so much optimized, but there's something that they appreciate about that hour and thinking a little more deeply about themselves. And they're like, so I don't really want to stop, but I don't know what to talk about. And I actually kind of have it happens very often because I end up seeing clients for quite a long time. And we do sit in that soup for a long time afterwards. Not, the what we work on, I'll explain in a minute, but we have this point where it's like you have to shift how you think about therapy. That if it's not a problem to fix, but maybe there's something you've been curious about, or maybe you've noticed this is how this same pattern keeps coming up with people, or people have said this a lot about you, or even just something that you start to, reflect on your own of just like, wait a second, have I always done that? Or have I wondered about that? So then we start bringing that stuff to therapy. And it's still a lot of the um, kind of tolerating the imperfect human. Because I think there's always that urge to want to come up and be like, but can't I fix this? I'm like, no, I mean, that's kind of that imperfect human thing. But we can learn more about that and we can gain more insight about that. Or wow, did it come up at this? And there are some subtle changes, but I think then it's more um the progress looks very different at that point. And I still find that people can find that valuable. I don't think everybody likes that, but I think for certain people that, yeah, it is really beneficial to work with that. And then I find I work with them through different seasons of their lives where that stuff is going to come up, where they're starting a business or they're getting married or they're having a baby. And like all this stuff starts to come up where they're like, wait a second, is that stuff we've been talking about? I'm like, well, pieces of it for sure are showing up at this point in life. And then there's a little bit of a new stuff. So there's kind of, I do think that some people can benefit from that long-term therapy, but it is a shift that people have to make from, okay, if it's not a problem, what am I doing with this thing that I like to do?
Yeah, I think this might be a difference in style because I will terminate in between and people come back, they get pregnant and now things feel so different or um, lose a job or usually something external in their life changes and so they come back for a while. But I will go kind of say like go do it on your own for a while. I think there's learning in n knowing that you've kind of terminated and that it's a little bit more effortful to get back in
Mm-hmm.
on the schedule. You have to
Sure.
like decide to come out of termination. I think in some ways can test you a little bit and sort of like how would I handle this if I didn't have someone to talk to on my own? Which I know can sound a little bit like, what do you mean people shouldn't have someone to talk to? But more like, we do find out about ourselves when, we're left to our own devices and we have to figure it out. Um,
Definitely. Mm.
and I will say that as my personal experience, that it became a practical reality I had seen a therapist while I was in grad school and then needed to end in order to do my fifth year. So it just, I couldn't go during that time.
Yep.
And it was a hard year. And knowing that I couldn't go and sort of lean on this support system, I was like, all right, I am on my own. I got to go figure this out. And if it had gotten to an emergency standpoint, of course I would ask for help. But like, it was more like, I, I'm going to find out what this is like. I don't have that. All right. Can I do it on my own? And I did.
Hmm.
And I know that's not how everybody's trajectory would go. And I wouldn't like discourage anybody from coming out of termination, but just that there can be a gift in that.
Oh, for sure. Yeah, no, I talk with my clients when I do sense that they're ready to terminate, and I'll like bring it up and it's like, "Hey, like it seems like everything's doing okay. Like we've been running out of things to do talk about it, things like things are stable, what if we wrapped up?" And there's always that moment of panic there for a minute, and i
Mm.
and i warn them. I'm like, "You're panicking now, aren't you?" And they're like, "Yeah." And I'm like, "Okay, that's fine. So what we're going to do between now and our next session is I want you to think about all the times that you are panicking of what if I don't have Dr. Hover here. And I want you to think about what we've talked about, what we've learned, maybe what I would say, and then see how you feel. And then come back in our next session. And if you want to terminate, we can terminate. If you don't, we don't have to, but I'm sensing that you're done." And they always do that. They're like, "Yeah, I panicked for like a week." And then, because I see a lot of people every other week. And so they're like, then that next week was, "Wait a second. I got this. I got it. It's okay." And then they start to use those things, and they definitely do. And sometimes I will see people come back after that termination, but and I prep them for that as well of, yeah, you're probably going to call me about 3 months later than you felt like you should have, because it's hard to come out of termination sometimes, but that's totally normal and fine. And so it's funny to see that same process. Like, yeah, it happens for sure.
And I could see kind of like what you just said. I could see the argument against where you sort of do like a soft termination where it's like, well, you're still open in my books, but it's not scheduled. So that makes it a little easier. Or I do have people who prefer to schedule like, can we put something on the calendar 3 months from now? I really don't. You say no?
I say no.
Oh,
Yeah,
I
because,
do it.
well, say more, and I'll tell you why.
Okay.
Because I don't think there's necessarily one bad or it's
No, no,
fine.
there's no right answer. If anything, like I will nudge people in the direction that I think would serve them, kind of like your like our topic today, like should your therapist agree with you or whatever. Like if I think, go find out how to do this on your own, I will nudge them in that direction. If they say I'm really not ready to do that or I really don't want to, okay, like let's figure out, a plan. And I do have some people in maintenance where they come about every 3 months, and
Mhm.
it works fine with my calendar because I'm like not booked out that far. So I'm like, what time you like?
Yeah.
Um, yeah, I guess I've decided that is kind of no skin off my back to do it. Tell me what's your thinking?
My thought is that if you want to push it out that far, I'll do like a month, like every month for like 3 months. If we're talking about terminating and people are like, "Well, what if I see you in every 3 months?" And it's hard for me to get back into it of just like, "Wait,
Mm,
what were we talking about and what's going on?" It's not like I completely forget, but there's like this cadence where it's just like, or a lot of times I will find that they'll forget that it was on their schedule, and then they get there and they're like, "I have no idea what I want to talk about." And it's like, okay, so I mean, that's a good sign. Like, that's great. So I do it more preventatively because I think in the past I've done that sometimes where people will come in, and if we have it on the schedule, it becomes something that is, it's like a safety net almost, right? Where it's like, "Okay, I've got this." And then when you get there, it's like, "Oh, wait, but everything's been good. So like, what am I doing here?" And I'm like, "Yeah, that's a good question."
that is an excellent
Like
point. Yeah, that definitely happens. And
so yeah, I don't know. I mean, I think that it's different strokes for different folks, and I think that there's no one right or wrong way. I think that's why fit is so important. Like, yeah, like does that work for you? Does that work for like finding the style that matches? Because I wouldn't say there's like there's like no structure to like, certain styles that work. Like obviously we kind of have an understanding of different styles that work, but um I think it's always important to find the right fit because that's also going to help you tolerate if they disagree with you more as well.
I mean, boy, that's true. And I mean, just to your point about like fit, I mean, it sounds like even between you and I think you are more comfortable doing what some people would call it like depth work or like insights based
Yeah.
work. Whereas I find that hard like as the provider, I find it hard to know like what threads to pull on, where to go when we don't have something that have identified to be working on. When people are like, yeah, I go to like learn more about myself, I can find that hard to organize the session
Mm,
around. And some, I think other people gravitate towards that completely, whereas
sure.
I think I am like I can be so, I'm definitely a behavioral therapist. And it's like, what are
Yeah.
we doing and
Yeah.
why? And like, towards what end? Um, yeah. And I mean, you made a good point there at the end about like, if you have a good fit, you can tolerate your therapist not agreeing with you. I'm going to
Mhm.
steer us back to that a little bit. So, okay, what about agreeing with you on politics?
Oof. That is so. I remember that was such a topic in grad school, I think more so talking about the future and when we didn't necessarily get to choose clients. I think that, and in any setting, I think that I would be working at where I didn't get to choose my clients. Like if it was a college counseling center, community mental health, hospital, like you see whoever walks through the door. In my private practice, I really curate like, hey, usually we're gonna align on a lot of things. And I wouldn't say that that's like a requirement. There's definitely times where politically people have had differing views from me. I definitely see it less in my private practice. So I feel like I'm prefacing that with I'm out of practice on that because a lot of my clients align
Oh,
pretty similarly with that. So I think that I mean, we see it in the VA work, obviously. And I don't know. I would find.
side note, Paige and I both do, I think like 1 day a week where we evaluate veterans for disability as, I guess we're contractors. I'm like a contractor of a contractor of a contractor for the VA. So neither of us is employed by the VA, but
Oh,
indirectly, the VA pays us, yeah, through an
yes.
intermediary. Apparently, we're money laundering now. Do you remember? Do you remember in Office Space when they had to look up what money laundering was? You channel money through an intermediary. Anyways, so yeah, so that's what she's talking about when she says in like our VA work because there, like I have 7 people walking in tomorrow, and I know very little about any of them.
No. Yeah, and
Could be
in that
anything.
context, it's you're not getting into so much nitty-gritty, like you would in therapy. Um, I think that where it comes to like any kind of disagreement, I don't think you have to align 100% on politics or, like I think, well, I don't know though, because then I wonder how it would be to form a therapeutic alliance with somebody who like vehemently disagrees with some core beliefs that you have or core values or, um, I don't know, like I
I
don't
stumped you.
know that I would really like if I was to get a therapist that was a staunch Republican. I don't know that I would have a great alliance with them in the first place. You know what I mean?
Because you are an established Democrat.
I would say so.
I think so. Um, I I think I struggle with this less, but there are some variables. Um, if if someone comes in and holds beliefs about some sort of topic of, you know, current events or whatever that are very different from mine. Um, if they need to feel, safe, maybe seen, maybe just, I don't find it that hard to sort of see like you believe this and that comes from a deep place.
Mm-hmm.
So I will say this is something that is like really important to me. So I think I work on this mentally a little bit more, where like even if we see it very differently, underneath you and I are both people who are like we're forming our beliefs out of deeply held values.
Sure.
And I read a book called The Righteous Mind. It's
Ooh, that's a
excellent
good one.
about understanding the different frameworks of morality that people use to determine if something is right or wrong. So being able to kind of like parse out a different belief in terms of like, oh, okay, they're using the justice framework and I'm using the care framework. And that's
Mhm.
how we're ending up in two different moral places on this issue. That helps me kind of get underneath the content of the topic at hand.
Mhm.
Um, and and there's a rare few topics where I'm going to struggle more with that, and in which case it's better to talk to someone who's not me. I'm
Mhm.
trying to shrink that down as much as I can, but
Yeah.
you know, like therapists are not, we're not priests. I'm
No.
not a Zen Buddhist master. What would they become? Monk. I'm not a monk. I am not perfect. I have not fully self-enlightened, and so there are going to be places where I can't do it. But it is important to me to try. Now, if what the client is really looking for and coming to me is just, I just want you to agree with these political perspectives I have, and if a lot of it is like, right, don't you see it that way? Don't you agree with this? Don't you agree that these other people are wrong and we're not in alignment? That's going to be really hard. So that becomes like a therapeutic topic, I think.
Oh, for sure. And it goes back to kind of the original topic, right? Of, should your therapist always agree with you? And you bring up this context of like, well, should you like almost like should you find somebody who's aligned with you in like a lot of these ways to have a good fit? And I don't think so, right? Because like what you're pointing out is like and it's important, I think, to be able to kind of distill things down and kind of understand that even if we come from different places, or maybe if, a therapist is an atheist and a client is a, very religious Christian, like you can still find, I think, a good therapeutic alliance if there is like this willingness to grow, or if there's kind of, and not grow to understand each other's points. Like you can still have those beliefs, but you can look at a lot of different topics and not have to necessarily move your needle to grow or understand and things like that. And you can, I mean, each person I think can learn from somebody who sees things differently, because I think a lot of times you can find some core things that are similar and you can learn more about yourself in that. But I think if you are looking for somebody who to agree with you, then that's going to be an important factor when you're looking for your therapist, like looking for fit. And I think it's important too to note that I think that it's also okay to need that for a minute, like to need like some validation, right? Like if it's like, okay, I'm maybe a little too like tender on this topic right
Oh.
now, that I need some support. I don't necessarily, I'm not ready yet to challenge that. I'm not ready. Maybe I want to start here, or this one topic feels really tender and I need some um uh, therapy around that. Like I
I
think
would
it's always
relate to that.
important to know where you're at in what you're looking for in a therapist. Because if you're going for somebody who's ready to go really deep, who's ready to challenge how you think about things or yourself, just to even play devil's advocate, then you like, if that's not where you're at, don't go for that kind of therapist. Go for somebody who maybe can short term, stuff like that. I think that informs what you're looking for. It's not bad if you need somebody to agree with you. And sometimes there are points where you do just need somebody to agree with you for a minute.
What do you mean when you say validation? I have a feeling I know, but let's see if we can define that term.
I think to help, like validation in the sense of I can see your point. Maybe I don't always agree, but I can see how you got there and I can understand why you would feel that way. And I can, maybe you just need to hear that. Like, yes, that's okay to feel.
Hmm.
Obviously, there's things like behavior and actions like, we can feel a lot of things and we don't always need to act on our behavior, act on our
Well,
feelings, but
yeah,
yeah.
exactly. Like we don't, as therapists, I think we try not to validate the invalid. For like an example might be like self-harm.
Yeah.
I'm not going to say that's okay,
Yeah.
but we can validate something, someone's underlying pain or distress and trouble regulating. There's some way to say the way you're thinking or the way you're feeling makes sense in some way.
Yes. Like almost I can see how you got here, right? And I can
Yes.
understand why you would feel that way. And sometimes I think that people need that as well of like, hey, A plus B equals C in this situation. I can definitely see how that happened. Does that mean that it's a perfect formula or equation? No. Does it mean that sometimes you needed to hear that? Because everybody comes to us for different reasons. Sometimes they are looking for validation, but they benefit from some insight and growth. Sometimes they don't have enough of validation. And it's like, oh, okay, we need to boost this up. Like, whoa, we're beating ourselves down here. Like, let's bring you up here. So yeah, I mean, I think that the theme of this episode is I think that validation is not agreeing with. Validation is really important. I think your therapist should always be able to validate you in some way. They don't always have to agree with you. And I don't think they should.
No, I don't think they should either. And I think that if there's a rupture, if you have a rough session where it feels like you're talking past each other or it's upsetting, most likely it's what you said, where the person is feeling extra tender. That made me say, aw, because like I so relate to that, you
Yeah.
know? And they want some validation just to say, this isn't out of left field. There is a valid reason why I feel this way or think this way. I just need to be told, like, okay, all right. But if the therapist kind of gets a cue, because as a therapist we are just sort of like improving all the time, we never, that's how I think of it, is like you're up there and you have no idea what the person's bringing in that day, you have no idea what's going to happen, and so you're making like educated guesses minute by minute by minute throughout the hour. And so it could be just that the therapist picked up on something where they felt like a shift in perspective would get this person unstuck. And so I'm going to make the decision, I'm going to choose the challenge route.
Mm-hmm.
But they didn't realize that the person was looking for the validation route. And so suddenly you're in this moment that feels wrong.
Mm-hmm.
But in some ways, I think that's kind of it's an inevitable problem because no therapist is so perfectly attuned and aligned that they make every one of those guesses correct, especially when they're just getting to know someone. And
Or
so
even later on, like
or
sometimes you
even later
can
on.
take a leap and it's like, hey, like I'm gonna push you a little bit on this, like maybe we haven't pushed in a while. Like if you go back to
Yeah.
the personal trainer method, it's like, hey, things have been going well. I think you're ready, right? Like I think your muscles are ready to try this new thing and push. And maybe I pushed too hard, or maybe I didn't read that, or maybe some of it is just the response of, ooh, I was comfortable for a minute. I thought
Mm.
I was growing. I didn't realize I was too comfortable, and like there's all of that. So yeah, you have to go back in and you have to remember that it's not always going to be perfect, but then analyze a bit of what that discomfort is because sometimes you might disagree with your therapist and that could be the sign of growth. That could be truly you push too hard too fast, or I'm not ready to go there. And it's okay to say that because that's feedback for us as well. It's like, okay, nope, not ready. Like, or maybe we missed the mark a little bit, or maybe I misunderstood that kind of stuff like that. But go back in, talk about it.
Oh, yeah. Yeah, that's so true. Did we cover this?
I think so. There was another point I was thinking about when we were talking about disagree. Oh, I think the last point I will say is I think that sometimes people might hear this and be like, okay, well, I'm ready. I'm ready for the feedback. I'm going to go into my therapist session and I'm going to tell me what is up with me. I think that I don't always bite when that happens because I don't always know that my clients are ready to hear all of that. And that is a piece, and it's not to say that people can't handle that, but the point that I'm trying to get to is that if you want your therapist to be honest with you and you want to have that, it's also about, are you ready to receive that? And I think it's helpful for clients to think about that for themselves, but also that's our job as therapists to think, okay, are you in a place where you can hear that? Because sometimes if we're holding back, it's not because we're not trying to be honest with you, is that there are many factors that might account for that feedback being received inaccurately or not being received at all.
Mm, yeah, I'm always saying, like, what did you hear me saying?
Hmm.
Because sometimes when I get back in response to that question, it's like, well, I heard you saying blah, 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 blah. And I'm like, whoa, that wasn't at all what I was saying. Let me try
Right.
and say this in a totally different way.
Yep.
And I'm usually, it's either because I'm saying something that I know is challenging or because I've noticed some sort of demeanor shift in the person where I'm like,
Yep.
oh, I saw them make meaning just now. Like I
Yep.
saw it happen, something like a flick in the eye or something. And I'm like, they just made some sort of meaning out of what I said, but let me make sure that they actually heard what I was trying to say. And it's so common.
Hmm. Oh,
And
for sure.
don't you wonder too, like how often that's happening just in friendships out in the world where one person says one thing and the other person hears something and it wasn't even close to
Hmm.
what the first person was trying to convey because we bring so much to bear on everything that we take in, you know, and we're processing in ways that we're not even fully conscious of.
Hmm.
And how many misunderstandings happen but aren't maybe they're unnoticed or people notice, but they don't know how to say anything,
I think
you
that happens
know.
all the time. I think that that's where there's a lot. I see that in how I wouldn't say like the epidemic, but more recently how people are more concerned about what other people are thinking or assuming that they're the only anxious one in the room and it's like, well, why do I struggle with this and they don't? And it's like, no, they are doing like there's this like shift that is hard to kind of get into other people's heads and think about that. And oftentimes that thinking like they're weird or there's something off about them and nobody else thinks that way and it's like no, a lot of people do but we don't talk about it.
Yeah. Yeah, I agree.
Yeah, for sure.
Okay.
Well, I think we're going to wrap up on this note, folks, but yeah, I hope you took some information away from this about kind of the nuances of a therapist's honesty and what it's like to on our end to be able to be honest and disagree with our clients, and it's not always a standard of practice where your therapist needs to disagree with you in order to do good work, and it doesn't always need to be the opposite, a way where everybody needs to agree with you. So we hope you've got some information about this, and we'll talk to you in the next episode.
Thanks for listening.
Bye.
This podcast is for informational purposes only. It is not a substitute for treatment of any kind.